Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. April 21st, 2021. Sooners won last night. Yay. Basketball, for those of you who are basketball people, hopefully OSU won too. I have no idea. But anyway, COVID update. Sports. Yes, sports matter because tonight's focus is normalization. We're going to talk a little bit about vaccination first, and then we're going to talk about normalization. So I get a lot of questions about the vaccine and should you do the vaccine? Well, let's kind of break it into categories. So you have two messenger RNA vaccines, the Pfizer and Moderna, which I've said are probably look like one of the greatest scientific or the scientific accomplishments of the last 25 years. Remarkably effective. And this is where this is why it's about understanding and explaining. So why are they so important and why are they so awesome? And why is the Johnson & Johnson almost essentially the same? Well, even though it's not a messenger RNA vaccine, because they give immunity. Excuse me, the difference between there's immunity and there's functional immunity. So let's give the difference. So if you get the Johnson & Johnson vaccine, it has pretty much straightforward an immunity rate of 75%. If you get the Moderna or the Pfizer, it's 95%. And again, the Moderna and the Pfizer are 95% effective, essentially, with one for anyone under 70. What's the baseline immune defect rate in the population? Is like 5 to 10%. So that's why people don't get totally immune, some people. So let's then look what happens in the Pfizer and Moderna group and the Johnson & Johnson group if they get the vaccine and they fall within the 5% in the messenger RNA ones or the 30% in the Johnson & Johnson. Well, the first thing is 90% of the infections are asymptomatic. So that gives you right off the top of the Pfizer and Moderna, since they have 5%, so 90% are asymptomatic infections. That gives you a functional, hey, I'm either immune or I never knew I got it rate of 99.5%. So that's key. If you look at the Johnson & Johnson, 90% of 30 is 27. So it's a functional immunity rate of 97%. But then let's go to the next group. So if you look at similar, like all the immunology stuff, it runs about 90 to 99% in the remaining 0.5% in the messenger RNA group, Pfizer and Moderna, and the Johnson & Johnson group, that they're only going to get mild infection. So if it's 90%, that gives you 90% of 0.5 is 0.45%. So that gives you a 99.45% chance, but it's probably closer to 95 or 99. So it basically gives you a 99.9% chance that you're only going to get a mild infection that doesn't cause you any harm. And it turns out with the Johnson & Johnson, it's 99.8 to 9%. So ultimately, functionally, you're immune. And so that's why I think there's so much confusion, because when you have people from the government saying that you're not immune and you need to wear masks when you don't, I think it's criminally negligent at this point, but hey, that's me. I think they're I think they're causing, the problem with doing that is mitigation strategies, which I've talked about, which is what we did at first, shouldn't have been done for more than 3 or 4 months. As we look at the swathe of destruction from mitigation, which is masks, closing down schools and doing all of that, I mean, we needed to do that for 3 to 4 months to figure out what the heck was going on. By May, we knew that kids weren't getting sick when they went back to school in Europe. We knew the data from China that none of them, except the very rare high-risk kid, got sick. When we look at the data in the United States, and so all you teachers out there and administrators, I need your help. I need you to step up. I need you to be leaders and recognize that the essential death rate from COVID in the United States for 17 and younger is 0. It's 0%. Number two, they virtually never spread it to teachers. It's essentially it's closer to 0 than 1%. So when we look at then math scores, which I'll post, that are 50% down, this year's been a total waste of time. We're destroying children. And number two, the suicide rates, the social dysfunction, the child abuse, the alcoholism in the families that the children are experiencing. We need the schools to be open. We need you to fight the battle. I need you as an administrator to fight the battle. Stop the fear mongering. If you get vaccinated, you're fine. If you don't get vaccinated, you're fine too. But that's the drill. We have to get the schools open. So, but that's going to get to normalization. Then let's go back to vaccines. What about kids? Do kids need to get vaccines? No, they don't get that sick. There's no point in doing an intervention in people under 18 if there isn't a net gain. And the net gain isn't anything. If you don't get sick from the virus in any significant way, why would you do a vaccine? I mean, it's that simple. I mean, now if you're a high-risk person, you have a high-risk child, you have a child with a thrombotic genetic problem or really bad pulmonary issues, yes, I think that's something you should consider. But your typical low-risk kid doesn't need anything, okay? Now, are they going to have to get it in order to travel and get on a plane? Yes, but but the reality is the risk-benefit ratio doesn't add up. But we just have to go with that. Now, if you're under 25, it's pretty much the same thing. But again, if you're going to want to do anything, you're going to have to get it. So I would always encourage the Johnson & Johnson. But again, the Moderna and the Pfizer are fine too, because for normalization, people are going to have to get the vaccine to travel and go to sporting events. So, it is what it is. I don't make the rules. I'm just trying to help people understand it. Those vaccines are very safe. What's the difference? The Johnson & Johnson is an inactivated virus where they stuck the spike protein on it from the COVID virus, and so you get the immune effect. The difference with the messenger RNA is you get a section of RNA that makes you produce the spike protein on your cells. 6 of one, half a dozen of another, but the Johnson & Johnson and the Novavax are not going to be messenger RNA virus or messenger RNA vaccines. I would anticipate the Novavax gets approved. Again, the AstraZeneca, too many questions. Study's not done well. I'm out on it. There's several people at the CDC who believe that it's still fine to do. I think they're just public health. And this gets then to the whole thing I wanted to talk about is, okay, the people in public health formally in this country have to realize, as someone who was in the public health service, that doing it the same way we did it in the 80s and the 90s doesn't fly in 2021. And so it gets back to what some of you may have heard me say in my moment in the sun on CNN. We have to talk with people versus at people. And if you're in the public health service, you're back in the day, you were trained that, hey, you gotta get the job done, blah, 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 blah. And you don't necessarily, and it's not like overtly stated, but it's communicated. You need to tell the people what to do, and you don't always have to be completely honest about it because you know more than everybody else. And that's old school. And so that's what happened with the director of the CDC, the NIH, the other person at the NIH, who I won't say his name, and so they talked down to the American people, and they lied to the American people because they thought the American people couldn't hear the truth. And so that then caused disorder and confusion and started the whole fake news cycle on COVID and made people question everything. And it ultimately has backfired. So that's why, again, being honest is what they need to do, and they need to be direct and correct and not promote a vaccine like the AstraZeneca that there's not supportive data that it's truly definitively safe for the vast majority of people. But again, that's me. That's my interpretation of the data. I mean, the number one thing with the AstraZeneca, they didn't do a large randomized controlled trial. They combined studies, and the big issue when they go, oh, the clotting thing doesn't matter is no, the clotting thing can matter because you look at the way the virus works and you look at the way the vaccine can work. And if it turns on the T2 helper cells, and it can increase clotting because it also makes gamma interferon go up, which again, it gets really esoteric and most people don't understand this, but it's just from reading and reading and reading. The vaccine can make gamma interferon go up, which increases your clotting profile. And we can try to lie about it, which we shouldn't do if we're in public health, because they think, well, if a few people die of clot and but we get a lot more people vaccinated, it's worth it. No, let's be honest. Let's be honest about it. Why can't we be honest in this country anymore about science? Well, because everyone has secondary intention. So let's get to the final part of my talk tonight. Let's discuss normalization. Okay, if you're vaccinated, you're immune or functionally immune, as I've told you. If you've been infected, sorry, you're pretty immune too. Okay, that goes against what the government's saying, but you're immune at least for 6 months, probably 12, and probably long term. Again, the data on that group, the best, largest study shows, again, 90% are immune, 10%, or excuse me, 90% are immune, 10% can get reinfected. Of the reinfected group, 90% are asymptomatic, 10% have mild infections, and it was 0% got moderate. Now, it was only a group of about 1,000 reinfected, but it was a Marine Corps study. So the bottom line is, no, you're fine, okay? And again, it goes against the narrative. I'm sorry, it's the science. So if you're going to get a vaccine, if you're in that group, I would always just get the Johnson & Johnson, because there's clear data showing if you get 2 vaccines, you can get sicker after the second one. So do the Johnson & Johnson, and then if the Novavax comes out and it gets approved, I would do that one too. So it's about normalization. We have to get kids back in school. We got to get kids normalized. Hey, us adults need to get normalized too. We need to start integrating with each other. Wearing masks is not natural. We need to look at each other in the face. There's oxytocin, which is a neurochemical in our brain. It's a hormone. It makes us want to look at each other and be friendly. If you can't see someone's face, it doesn't work. And so the people who keep on promoting, we can't wear masks, we'll have to wear masks till 2022, hogwash, non-scientific. It's the same people who said masks didn't work now saying masks for forever because they don't understand anything about mitigation strategies or science, sorry. Number 2, the greatest harm that can happen now from COVID is retaining COVID control rules on us, because they're damaging, first, to the health of the country. Second, they're damaging to the economy, which in turn affects people's health. And third, they're authoritarian. And so that doesn't work either. So, and again, you can take your own personal look at this and make your own decision, but you can't live in fear over COVID any longer. You can get a vaccine, you cannot get a vaccine, but eventually enough of us are going to be vaccinated or infected, which I think will be in the next 2 weeks, that there's essential herd immunity. Now, with herd immunity, the thing to remember is there'll still be pockets of people getting COVID. It just means it's not really it's not spreading across the country or across the world rampantly anymore. The second thing is, if we were doing 2 million tests on the flu every day from December through the end of March or April, we would have probably very similar numbers of cases, but we've never done that because people don't get flu tested that much. It's just reality. So again, these numbers are going to come down. All the data shows the vaccines worked and the people who've already been infected are immune. So that's the summary. I mean, Kim, am I missing anything?
No, the only thing based on what you said was when you say if you've had it, that you're basically immune for maybe up to 12 months.
Maybe. I think you are, but I mean...
Well, but I want to make sure, and you've talked about this a lot in the past, but if you get the lab test and your antibodies aren't showing, that doesn't mean...
Yes. So what happens with your antibodies, and it's going to probably happen with the people who got vaccinated, you go from B memory cells and T memory cells that make T killer cells and your antibodies, the B memory cells, and they then turn into germinal B, or they're reactive B cells to memory B cells to germinal B cells, which are in your bone marrow. So they're ready and poised to go, and that's been shown in multiple studies. Again, I don't know why the studies are not. I don't know if I'm the only one who's reading them at times. I mean, I know some of my friends are, but I'm just perpetual. And I know Dr. Z is, who has his webcast and has that in immunology. Z-Dog has. So there's at least a few of us who are reading the data and can get, has gotten a lot of people on his webcast that confirm what he's saying, which is very nice. I'm just more like, here's the data, blah, blah, blah. But he's a very helpful doctor for all of this. So did that help answer that question?
I think so.
I think so. The bottom line is you go from reactive B cells that make your initial antibodies to B memory cells, which then turn into B germinal cells in your bone marrow. So they're permanently programmed to make the antibody. And as long as there isn't a mutation that matters, and there still hasn't been, oh my goodness, there's not been a variant that matters. I would almost say, there's a lot of words I could say. Now, if you haven't gotten COVID, you haven't been vaccinated, sure, some of the variants might make you a little sicker, but most of the variants won't. So the bottom line is the fear and loathing on the variants is hogwash, okay? It's all crap. It's crap, because they want to keep you scared and manipulated, so you'll wear your mask and be frightened and be dependent on people to tell you what to do. So my parting words would be, don't be a lemming, be a thinker. That's it. Good night.